Hello, this is Siddharth Dambar from Chicago Arthritis and Regenerative Medicine. Welcome to our weekly live broadcast. This is our Wednesday broadcast where I'm discussing topics relevant to what we do here at Chicago Arthritis and Regenerative Medicine, focusing on non-surgical management and evaluation of arthritis, tendinitis, injuries, and back pain. So today I'm talking about inflammation, joints, and heart disease. So inflammation is something that's super important and interesting to me as a rheumatologist because I see a lot of patients that have inflammatory arthritis conditions where inflammation is causing their problem. Inflammation is also interesting to me because as someone who also specializes in regenerative medicine, I know that there's a big difference between acute inflammation, which can be helpful in the right circumstance and can actually get people better, versus chronic inflammation, where you have more chronic problems and issues that develop. So acute versus chronic inflammation is interesting. And there is a recent article that came out of the Annals of Rheumatic Diseases that connects joints, inflammation, and heart disease in a really interesting way. So we know that patients that have chronic autoimmune or inflammatory conditions, including rheumatoid arthritis, psoriatic arthritis, and other chronic autoimmune issues, that they have higher rates of heart disease as well. So an interesting question is, well, if you control the inflammation, can you improve not only their joint issues, which we know that you can, but can you also improve their cardiovascular issues as well? And realistically, you need to look at that over many years, possibly even decades when it comes to clinical outcomes. But there's an interesting study that came out, Annals of Rheumatic Diseases, where they actually looked at this from a imaging or structural way. So we know that people that have cardiovascular heart issues can also have certain findings on imaging, on ultrasound, and on MRI, where you can tell that there's a reduction in the distensibility or flexibility of the aorta, or in the size of the left ventricle as well. So in this particular study that was recently published, they found that in patients that had early rheumatoid arthritis, if you treated them early and appropriately aggressively, you could actually improve those measures on imaging, on MRI imaging. Specifically, what they found was that if you started people on either methotrexate or methotrexate and Enbrel, that compared to controls, compared to people who are not taking the medication, that there was an improvement in aortic distensibility and left ventricular mass. That's really interesting because it is a really objective, definitive finding that controlling systemic total body inflammation will not only help out the joint in these conditions, but will actually also help out in the long-term cardiovascular disease issues as well. And it can do so even at that 1-year mark, which is pretty interesting and exciting when you really think about it, because controlling chronic inflammation is important. It's important because you have conditions where you have chronic inflammation, such as rheumatoid arthritis, but you also have conditions like metabolic syndrome, where chronic inflammation is a problem. And when chronic inflammation is present, you get a lot of other problems, including heart disease. And so a lot of times you need to use medications in these kind of conditions because the overall inflammation is just too much. And this study proves that that's actually beneficial from the cardiovascular disease standpoint. But it also is an indication that if you have one of these conditions, you should be thinking about the long-term consequences, including heart disease as well, and doing all the right things that you can to actually reduce that chronic inflammation. So I always recommend for folks that have these kind of autoimmune issues, make sure you're seeing a nutritionist, make sure you're optimizing what you can from a dietary standpoint. Some general recommendations in that regard would include more of a plant-based diet, avoiding refined sugars, alcohol in moderation, and limiting red meat. I still think working with a nutritionist or a dietitian who has more expertise in these kind of inflammatory kind of issues is helpful because each individual is a little bit different. Meaning, if you come from a background where people have traditionally eaten certain types of meat and fish, your body will probably react better to that than maybe if you come from a genetic or family background where that was not the case. And so nutrition definitely plays a part of that. The other one is supplements. The supplements that I generally recommend for my joint patients include glucosamine, omega-3, and turmeric. The last two, omega-3 and turmeric, are helpful from an inflammation standpoint. Turmeric can definitely help in terms of joint issues, in terms of it can help as much as an anti-inflammatory medication when it comes to joint pains and arthritis pains. Omega-3 can not only help with joint pains, but it's been shown to help with inflammation in rheumatoid arthritis patients, improving stiffness and fatigue as well. And so those two supplements, I think, are helpful from an inflammation standpoint, omega-3 and turmeric. And I think that combined with nutrition makes a big difference from an inflammation standpoint when it comes to these sort of conditions, as well as reducing heart disease long-term. Controlling inflammation is important. Acute inflammation after an injury can still be helpful, and it's really how regenerative medicine works and the basis for why it helps, that you can restart a normal healing process. But if that inflammation acutely is out of control, or if you have chronic inflammation, those can be real problems. And if you control them, we now have evidence that you can actually make a difference from a cardiovascular disease standpoint as well. Great. Well, until next time, I hope everyone stays well and healthy. As a reminder, I'm doing a live broadcast twice per week, Mondays and Wednesdays. If you have questions, send them my way. And until next time, have a good day and live well. Bye-bye.